Many healthcare professionals recommend that patients with serious illnesses consider seeking out centers of excellence for treatment. But what are centers of excellence, and how does a patient go about finding one? We ask these questions of Dr. Ross E. Long, a member of the Connectcare 3 medical panel. Here are his professional opinions.
The one underlying premise in the Centers of Excellence concept is better outcomes generally come about with centers that treat a higher volume of patients. If I have a relatively common condition, I can find care for that locally fairly easily. As the complexity of that increases, there are fewer patients with that condition. The label of Centers of Excellence then gets placed on those organizations. It means that you've got a core group of people who have experience and dedication to a particular problem. The concept is fantastic. The problem with the Centers of Excellence, though, is that at this point in time, the label of Centers of Excellence is not one that is standardized. There is no one place that a patient can go to, one registry or one website that would actually provide you with all the information that would be needed to a center claiming to be one of excellence. It becomes very difficult for patients to sort out what would be the best one. A Center of Excellence for a hospital is actually a potential marketing tool for them. They can promote themselves and therefore attract more patients. For insurance companies, Centers of Excellence, there's a financial component to that. They have to try to keep their costs down in order to keep their rates down to pass on to the consumers. That also tends to sometimes cloud the independence of that assessment. To ask a patient to kind of take in all those factors and make an informed decision about where they would want to go for a treatment is almost impossible. What would be valuable for patients is a resource that a patient could turn to that can do the research on the different centers and report back to the patient, a patient advocate, a patient navigator, to help them understand all of this and present the information for them to allow them to make an informed decision, especially if they're going to be traveling a distance to get to a center. To have a staff of medically trained people who understand the terms, understand the conditions, understand all the issues we talked about, it would be extremely valuable. I don't think you can do it without them. And those would be the people that I would rely on because of that, because of the fact that they're independent. They're not an advocate of any particular center. They're simply trying to provide the information that I'm going to need to make my choices.